How you doing, guys? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate, coming at you live in Yorkville, Illinois. Happy Monday. Early afternoon, I believe. Early afternoon. All right. I'm coming on a little bit earlier. Normally I do it after patients on Monday, but unfortunately I had a funeral to go to. So my wife's grandfather passed away about 10 days ago, and so with all of the stuff that's going on, we're finally getting around to the visitation and the funeral. So I have early office hours and travel about an hour away for everything. But wonderful man, had an awesome life. Actually lived for like 15 years with cancer, if you can imagine that. So thank you for your thoughts and prayers. I always appreciate that. So because I have to leave a little bit early, I want to go over with you, do a live a little bit early. Awesome Monday afternoon. I just hit my camera there. So before I talk to you about having a low cholesterol and a heart attack, let me say hi to a couple of people that are joining. So Heidi, how are you? Dawn, how are you doing? Katie, always good to hear from you guys. Barb, Diane, how are you doing? Diane, I hope you're doing well. Toronto, Canada, that is awesome. Where are you guys watching from? I always love to see where you guys are from. We have Canada, I believe, Arizona, all over the place. Illinois, obviously. So thank you guys. I always appreciate you guys joining us. Now, guys, many times, when it comes to heart disease, women are a little bit behind on when it comes to heart disease, but they quickly catch up as far as heart disease and markers and things like that, especially after menopause. So yes, ladies, heart disease does affect you. However, a lot of times we think it affects men primarily. But again, guys, remember, when we talk about heart disease, it is still the number one killer in the United States. So cardiovascular disease. So, a lot of times, when we look at the news and everyone loves talking about the immune system or, because everybody is talking about COVID-19, and things like that. But always remember, we still have a lot of people that are dying from cancer and heart disease as well. So let's talk about heart disease. Let's talk about a heart attack. Now, reason why I want to talk about this is I had a gentleman who actually came and saw me, young guy, actually younger than me, and he had a heart attack. So I had a heart attack. And you wouldn't think a guy younger than me, it would be possible to have a heart attack. But doctor said, yep, you had a mild heart attack. And so I said, well, if you've had a heart attack, we need to do a cardiometabolic panel, not just cardiovascular stuff, metabolic panel. So they had actually confirmed it on, lab testing and looking at some markers to see if there had been any kind of heart damage, and things like that. And guys, doctors are awesome. They're the fire department. They have the ability to be able to put the fire out and be able to treat people when they have a heart attack. But the problem is afterwards they kind of left them in the dark as far as what to do afterwards. Because remember, they can put out the fire, but they really don't care what caused the fire, and they also are just willing to keep putting fires out afterwards. And so when I met with them, I said, well, what did they want to do to help you prevent having another heart attack? Did they do any kind of advanced testing? No, they tested my cholesterol. That was it. Did they did they look at any of your diabetes markers or anything like that? No, cholesterol. That was the only thing that they actually looked at. And I looked at his cholesterol numbers, and his cholesterol was actually 140. All right, so just think about that for a second. He had a heart attack. His total cholesterol was at 140. So here's a person who had a heart attack, yet cholesterol isn't even elevated. It's not even good. It's actually extremely low. So how can this person have a heart attack when his cholesterol is actually low? In fact, doctors were absolutely befuddled. They had no idea why. But I will tell you this. Is that they wanted to, a man in his early 40s, they wanted to put him on statin drugs with his cholesterol already at 140, and I will show you why that would have absolutely devastated his body. Okay, it's going to devastate their body. Now, I want you to know something. You go to any doctor, and their number one marker as far as what your heart attack risk is what your cholesterol numbers are. And even if they are considered normal and you have a heart attack, they're still going to try to lower your cholesterol. Doesn't make a lot of sense because I'm going to show you why you need cholesterol for so many different body functions, okay? Like I say, there's no such thing as high cholesterol. There's just appropriate cholesterol. That's it. Your cholesterol is high. It's because the body needs it. Now, let's talk about this picture right here, all right? So you're probably looking at this and you're saying, why on earth does Dr. Nate have a picture of skid marks on a highway? But I want to give you an example of kind of how crazy it actually is, because many times medicine is just actually following an algorithm saying, if you've had a heart attack, we're going to put you on cholesterol meds, whether you need it or not, but this is just our standard of care. This is just what our protocol is. And guys, if you have a doctor that only follows a standard of care, who follows as a protocol, you do not have a doctor. You have hired a technician that cannot think for themselves. Although the problem is that many times doctors will do it anyway because they're scared. Even though it doesn't make sense, they're scared because they have to follow the standard of care. And if they deviate away from that, they can get their license pulled, okay? So what on earth does this have to do with cholesterol? Okay, I'm going to just show you your way of thinking. So, person has a heart attack. They open up and they look at the arteries, and that they see there's fatty deposits and cholesterol. So inside the arteries, it is clogged with cholesterol. So they assume that cholesterol causes heart attacks, and then they in turn try to drastically lower cholesterol, thinking that there's going to be some kind of improvement when it comes to heart attack outcomes. I'm going to show you doesn't actually change it one bit, okay? And I'm not even going to give you an opinion. I'm actually going to give you facts. So what on earth? Because just remember, it's just simplistic thinking. Person has a heart attack. Person sees there's fatty deposits. Doctor blames cholesterol. Doctor lowers cholesterol, okay? Let's use that same level of reasoning to this, okay? Person has a car accident, all right? Person has a car accident. They realize, the accident investigator realizes that there are skid marks at the scene of the accident. So the accident investigator then decides that skid marks causes car accidents, and then in response, they coat the road with Teflon in order to prevent skid marks, because using that level of reasoning, the skid marks are actually what are causing the accident. It's the same level of thinking. It's the same level of thinking. Guys, you know this. Skid marks don't cause the accident. This is a reaction to an impending accident. So think of this. If someone has a high amount of fatty buildup in their arteries, it's not cholesterol's fault. It is, for some reason, it was needed in order to try to stabilize the body. Now, is there a long-term consequence? 100%. But it's the body's way of adapting to try to help you live longer. Hopefully that makes sense, guys, is that if you stop thinking of everything as a disease, but actually as the body's way of adapting to try to help you live longer and survive, then you'll have a different perspective when it comes to actually cholesterol, okay? So this is actually this gentleman's test. And I don't know if you guys can actually see that, but I want you guys to notice something, is that when you look at his HDL and his LDL cholesterol, that it's actually at 140. And so his cholesterol is actually dangerously low, yet he still had a heart attack. But when you start looking at some of these other things that we look at when it's actually looking at heart attack risk, you can see that his glucose, he's actually losing blood sugar control. So his glucose levels are at 102. You can actually see that his liver is having some issues, in fact, producing what are known as globulin. Remember, globulin, immunoglobulins. So his immune system has been taking a hit due to chronic inflammation. You can actually see that his insulin levels, now remember this, insulin levels are at 27. 27, which means he is extremely insulin resistant. In fact, he's pre-type 2 diabetic. You can see his triglycerides are actually at 277. That's really that's actually a measure of like the worst cholesterol, is when you talk about high intensity or high, I'm thinking about exercise, high density lipoproteins, low density lipoproteins. Triglycerides are the very lowest in density of lipoproteins as well, and he's at 277. Where we actually like to see that is about 60 to 70. And so you look at another marker too, his C-reactive protein is at 3.6. So what that means, C-reactive protein, when that is elevated, that is an inflammatory marker. So here he has actually normal cholesterol, but his inflammatory markers are actually through the roof. So that's because there is actually something happening in response to inflammation. There's some kind of infection that's happening inside of the body. So if you look at the amount of the types of cholesterol that he's making, when you look at all of these different things, basically the cholesterol that he is making is actually oxidizing, and it is in fact damaging the arterial lining. And because these types of cholesterol are very heavy and they're very dense, okay? So let's talk about the fact that how can someone have a normal cholesterol, yet they have some kind of issue taking place that would actually cause some kind of heart attack. So what are the lab markers that you're going to look at instead? One of the things that we're always looking at when it comes to cholesterol is we don't care what a person's cholesterol, whether it's high, whether it's low, whether it's on the button or whatever medicine says it's where it's supposed to be at. Well, instead, what we want to actually measure is what is the quality of this of the cholesterol? What is the density of it? So I want you to think of something. We always call them, hey, do you got tennis balls or do you got golf balls? So think of this. If you're going to hit a ball against a tennis net is designed to stop a tennis ball. But if you have a golf ball and you hit it against a tennis net, chances are it's going to be able to go through. And that's why when you got very heavy, dense lipoproteins, these lipoproteins then have the ability to be able to bury underneath the endothelial lining of the blood vessel, of the artery, and cause an inflammatory response that then must be dealt with by the immune system. So when the immune system is actually dealing with that, then what happens is that's when you start to have the buildup of plaque. So it has really no bearing as far as how much cholesterol you're actually making. It's actually the type of cholesterol. Number two, the other one that we're looking at is you're looking at what's known as C-reactive protein, which is an inflammatory marker. Guys, we know that if your C-reactive protein is above 3, you are a very high risk for having some kind of cardiovascular disease. And I have seen people's C-reactive protein as high as 27, 28. Now, the thing is that they are dealing with either some kind of autoimmune type reaction that's taking place, or they have some terrible underlying infection that has been going on. It might actually be within the gastrointestinal system as well. So again, it's an inflammatory marker. And then the other thing you got to look at is you got to look at your insulin levels, you got to look at your triglycerides. So those are just some basic markers. In fact, doctors never measure insulin. They measure blood sugar, maybe A1C, but they're not measuring insulin, because once you start becoming insulin resistant, you start seeing those triglycerides start to go up. This means that you are becoming a type 2 diabetic. And remember this, if you are a type 2 diabetic, guess what? You don't die usually from diabetes, you die from the effects of diabetes. What are the effects of diabetes? Well, high insulin causes kidney issues. High insulin causes basically damage to anything that has an endothelial lining, okay? So it damages soft tissue. This is why they measure A1C, because remember, the red blood cells are actually connective tissue, so they're measuring the degradation of those blood cells. But remember, high insulin also damages the arterial lining, because remember, it's an endothelial lining. It damages the kidneys. It's an endothelial lining. And so this is why it damages the skin. So guys, think about it. It damages so much stuff, which is why people with type 2 diabetes, why they have a high risk for having a heart attack. It's also why they have problems in their vascular system. This is why they lose a foot, why they have their toes or feet amputated. This is why they actually have kidney failure, because that high insulin continues to damage and assault and inflame the soft tissues inside the body. That's why people with high blood pressure or high blood sugar and insulin issues and things like that, why do you think all their joints hurt and they're the ones that are getting all the joint replacements? Okay, so guys, it has really nothing to do with cholesterol. It's the quality of your cholesterol that you're producing. Tennis balls or golf balls. It's, hey, do you have some kind of hidden inflammation that's going on due to some kind of infection? Or what are your insulin levels like? And what are your triglycerides? And yes, guys, stress will cause an elevation in insulin levels. So it's not just eating too much sugar, although everyone would benefit from lowering the amounts and types of sugar that they're consuming all the time. So what do we do then? You get to the reason why it happened in the first place. Physical, mental, chemical stressors. Physical, mental, chemical stressors. Well, Dr. Nate, I am taking a statin, right? Because I love my doctor. He's a nice guy, super nice guy. And he told me if I go on a statin drug, it's going to really take all my problems away, okay? Let's ask this question: statins really work, all right? Do they actually work? And remember, this is not my opinion, okay? This is not my opinion. Remember, statistics do not lie, but liars will use statistics. And I'm going to show you how liars in healthcare actually take statistics and they skew them in order to scare you into taking some kind of statin drug, okay? Now, this actually comes from Business Week. This is not a new thing, although everybody forgets about this, but Business Week magazine, this was, gosh, I don't have the date on here, but this was about 10 or 11 years ago. I think this was from 2009, 2008 to 10, right around there. You can probably just look this up anywhere on the internet. But they asked the question, for many people, cholesterol drugs may not do actually any good, okay? They probably lost a lot of advertising revenue from all of these cholesterol drugs. And guys, we're gonna see that cholesterol drugs were just the biggest scam on the face of the earth, putting so many people on it. So here's what they did. They looked back and they looked at the data. They looked at the stats. So they went back and they did kind of looked at metadata versus saying, we've had these people on these for this amount of time. Are they really doing any good? And here's what they actually found, is that the benefit of being on a statin drug was 0%. 0%, meaning it did not reduce your risk of having a heart attack at all. So if you are over 65, the benefit you got from being on a statin drug was 0%. Women, all women, it didn't benefit them at all. And they also saw a 0% reduction in total deaths. And isn't that why you take a statin drug, is to prevent yourself from dying of a heart attack? And yet they found 0%. So if I said this, listen, if you want to work with me as a doctor, you have a 0% chance of getting better. How many of you would be beating the doors down to be able to work with me? Yet people will actually still read this and still go on a statin drug. And the reason why they do that is because they're fearful. See, fear, when you're fearful, you stop using your brain. You stop reasoning. Even if it doesn't make sense, you are fearful, you will still do it, which is why actually so many people are still wearing masks. And they realize that it doesn't make sense, yet they're still doing it because they're fearful of a virus. So people over 65, women, and a 0% reduction in total deaths. 0, 0, 0. Now, are there people that it did benefit? Yes, they did. They said this, they said that the people that have benefited were middle-aged men, 46 to 54 years of age, who had already had a heart attack, already. They said that about 100 men, 99 to 100 men, needed to be on this drug in order to prevent one heart attack, which means that the efficacy was actually 1%. So you actually saw a 1% reduced risk of having a heart attack. I know some things that actually can reduce your risk of having a heart attack a lot more, like starting to eat better, starting to exercise, stop eating inflammatory foods, stop eating so much sugar. Those will reduce your risk a whole heck of a lot more. So here's what they found though. They said the NNT, guys, ask your doctor when they want you to be on a medication, say, what's the NNT? And the NNT is this, number needed to treat. How many people need to go on the medication in order to prevent one episode of its intended consequence? Meaning, I'm going to take a statin drug, it's going to lower my risk of having a heart attack or stroke. How many people need to be on it in order to actually prevent a heart attack and stroke? They actually found that anywhere from 70 to 250 people needed to be on this medication long term in order to prevent one heart attack and one stroke. Now we're literally getting into that your chance of it actually benefiting you is about 0.5%. 0.5%. Okay? So here, take this medication. You have a 0.5% chance of it actually benefiting you. And actually over 500 people needed to be on it in order to prevent death. And they're like, we think it's over 500. That brings it down to about 0.2%. Literally 500 people need to be on the medication in order to prevent one death whatsoever. All right? So guys, that is the real statistics when it comes to being on a statin drug. Now here's the thing. This is what's absolutely mind-numbing, is that when you look at statin drugs, the side effects are horrible. You start lowering cholesterol. I'm going to show you this in a second. You start lowering cholesterol, you start lowering all hormones inside of your body, including cortisol needed for a stress response, including your testosterone, including your estrogens, including everything, because cholesterol is a foundation for your whole sex hormone system. You lower that, men, you're going to lower testosterone. You're going to go on a statin drug, you're going to lose an erection. Not only that, but cholesterol is actually what is a primary component of what makes up your brain matter, your brain tissue. You go on a cholesterol drug, you are literally causing things like dementia, Alzheimer's symptoms, and things like that. Okay? Who said it? They do. It's not my opinion. And in fact, if you look at on the actual label, here is what they say. Here is what they say. But they're actually, they're not, the doctor isn't telling you this. This comes from Lipitor. They say this: Lipitor has not been shown to prevent a heart attack or heart disease. So it hasn't been shown that. Crestor, another one, has not been determined to prevent heart disease, heart attacks, or strokes. So they actually say it. They say that we're going to give you this, but we actually are telling you we don't have any research that's actually going to tell you that it's going to prevent a heart attack or prevent a stroke. But I'm going to tell you that about 20% of people are going to have severe muscle breakdown called rhabdomyolysis. Their joints are going to hurt. A man's going to lose his erection, and he's going to have problems with dementia and brain fog. But there you go. We actually, looking at the research, your chance of not having a heart attack is 1 in 250. Guys, does this make you angry? This makes me justifiably angry. I have a moral indignation for things like this. And the reason why is because I see people suffer, and they're suffering. They're taking this because they trusted their doctor, and the doctor is giving it to them, even though they probably know, if they're reading their own research, they know it doesn't work. But they have to do it because they have to follow a protocol. So my question is a doctor even a doctor anymore? Or are they just a clinician that is actually forced to follow a protocol from something that's higher up? It's something to think about, okay? So guys, why does this affect so many different things? Here's cholesterol, and look at all the hormones it influences, like your progesterone, your DHEA, your estrone, DHT, testosterone, estradiol, estriol. That is the foundation for your whole entire hormone system. It is the foundation. You mess with your cholesterol, men, you are messing with your testosterone. And let me tell you something, is that men's testosterone is already too low. It is woefully inadequate in so many people. And the reason why, because they already have things like insulin issues. They already have blood sugar issues, which can tank your testosterone. And imagine that it's already low, and then to even lower it even more. So here you go, they look at their cholesterol and they say, lower the cholesterol, the better. It can never be too low. I've actually had people tell me this. Yes, it can be, because guess what? Cholesterol is actually making up tissue of the brain. Cholesterol is making up your hormones. It's making up all of those different things. So remember, guys, the body doesn't make mistakes. It doesn't make mistakes. Guys, do me a favor and please share this on your timeline. Share this, especially for people who you know they have had issues with heart attack, stroke, cardiovascular disease, high blood pressure, high insulin, and things like that, because you have to get to the reason why, and being on a statin drug is not actually making them better. Neurologically, it's making them worse. Hormonally, it's making them worse. Their muscular system is making them worse. All of those different things. Guys, I've had people who literally, and I can't tell people to go off of medication, but once I showed them this, they decided to take themselves off of their different medication, and they're like, within 3 or 4 days, they're like, oh my gosh, I felt so much better. My joints stopped hurting. My legs stopped hurting. But even if you are taking a statin drug or cholesterol lowering drug, how many times did your doctor actually say, you know what, you need to be on CoQ10? And the reason why is because, remember, cholesterol lowering medication doesn't lower cholesterol. It blocks enzymatic pathways within the liver, which is also blocking the production of CoQ10, which is actually a basic enzyme that's needed for cellular respiration and energy production in every single cell inside of your body. It's called CoQ10. Look up what's known as the Krebs cycle. Krebs cycle. Look at the very end when the cells start to spit out some ATP to use for energy in the mitochondria. You need CoQ10, and cholesterol medication actually blocks it, because cholesterol medication is not lowering cholesterol. Cholesterol medication is actually interfering with liver function, is what it's doing. So guys, get to the cause, get to the reason why. Guys, if you're from the Yorkville area, we're doing a talk on this and going into detail. It's going to blow you out of the water. Cholesterol, medicine's biggest scapegoat. This is going to be a week from tomorrow, Tuesday, October 20th, 6 o'clock, right here at Exemplify Health Center. I know some of you have said, hey, I want the webinar. I will see if we can work on getting the webinar done. But we'll see. So it's only if I have enough time. But Tuesday, 6 o'clock, it's going to be an in-person event, October 20th. How cholesterol, medicine's biggest scapegoat. We're going to talk to you why actually cholesterol is good and the markers you need to look at instead when it comes to your true heart attack risk, and how you actually test, how you measure it, but what will cause an increase in heart attack risk with the physical, the mental, and the chemical stressors. So hopefully, guys, that makes a lot of sense. I appreciate you guys being on. And guys, as always, please just make sure you like this, give me a thumbs up. More importantly, make sure that you share this with other people, because there's a lot of people that are taking cholesterol medications. They're taking it out of fear, and let them, at least give them the information that they can start making a decision for themselves. Remember, the most dangerous thing is when people become educated. So guys, appreciate you guys all. Love you all. Have a good rest of your Monday, and we will see you guys very soon.